I'm going to be performing an integumentary physical assessment on my patient. I've already completed my national patient safety goals, and I've already told my patient what I am doing. So I'm going to go ahead and start with my assessment. I always want to start with inspection, but for this assessment I can simultaneously inspect and palpate. So I will start with the head of my patient and work my way down to his toes. So as I'm inspecting his hair, I am looking for hair distribution, looks even. The color of his hair is blonde, and there are no parasites such as lice in his hair. And as I palpate, I'm going to ask my patient if he has any tenderness.
No.
Great. And as I work my way down to his face and his body, I am noting that his skin color is appropriate for ethnicity. And when I am assessing my patient's skin color, I'm noting any variations or abnormalities such as jaundice or flushing. And for the areas of my patient's body that are covered, I would ask my patient to lower their gown so I can inspect and palpate the rest of his body. So I'll do that now. As I lower his gown and I'm assessing his skin, I am looking for lesions. I am assessing the temperature of his skin. His skin is warm and it's smooth and dry. As I make my way down to his extremities, I am going to assess his capillary refill, just less than 3 seconds on both sides. I'm also looking at his fingers for clubbing, and he does not have any clubbing. I'm also looking for edema, and he does not have edema on his upper extremities. I also want to assess skin triggers, so I will lightly pinch his skin and make sure that he doesn't have any tenting. Tenting would be a sign of dehydration, and my patient does not have tenting. And as I make my way down to his lower extremities, once again, I'm still noting his color, if there's any lesions or any abnormalities, any bruising, any birthmarks, which his skin, once again, is still warm, it's dry, it's smooth. And I will assess his capillary refill at his lower extremities as well, also less than 3 seconds, and there's no clubbing. Great. And the last thing I will do is look at my patient's back. So I'll have him sit up for me and I'll assess his back once again for any lesions or abnormalities. If my patient does have a lesion or a pressure ulcer, I would want to note the location, the distribution, the size, shape, color, texture, characteristics, exudate, and the reason for that would be so that I can document it in my EHR and so that we can assess and follow up on that lesion. So once my integumentary system physical assessment is done, I'm going to assure my patient's safety and have my patient's bed lowered with the side rails up and make sure that his call light is in reach.